Hello everyone, it's Fred here, and in this video I'm going to explain why you're probably not getting anywhere with your injury or pain. So to start with, we need to talk a little bit about what you've tried previously or what you've thought about why you're injured or why you're in pain. So typically what people tend to try when they get injured or they get in pain is they kind of brush it to one side and think it's by random chance, or they haven't warmed up properly, or it's just bad luck in the moment, whether that's in training or the injury happens quite randomly. A simple framework I like to use to kind of break down what might be happening for people, which is what I go through with clients. This really simple 3-step process. So number one, subjective assessment, but you can ask yourself these questions as well. So what I do with clients, I talk to them and ask them questions about their previous injury history, their pain, so what causes the pain, what type of pain is it, how painful is it, all these questions, their ideal outcome from rehab, what they think is causing the pain, what they've tried previously, what's worked, what hasn't worked, why they think it's worked or hasn't worked, which is really important again. Once we've got that, and even if you ask yourself these questions, you can then understand your expectations and what you actually think is going on. That's one thing, versus what's actually going on at a physical level at your body. So that's when we look at physical assessments. So a full body assessment up here, where I look at how people are moving. So essentially, how well are they moving? I don't mean this in the sense of how well are they performing a squat or a deadlift. I mean it in the sense of how well are they performing movements such as just bending down, touching the toes. A squat is in there, so I meant a barbell squat, but yeah, I will look at them just doing like a normal squat. How well do they hinge? How well do they move in general as a collective, as the full body, doing reaches, walking, etc., etc. So that gives me a good picture of if there's anything to clean up from that point of view. And usually with people, depending on what sport they do, movements that you neglect or movements that you don't do very often, you tend to get into bad habits. And it's not necessarily causing injuries, but there's room for improvement with particular movement patterns that could aid or potentially prevent future injuries. So that's the first thing. Number two then is joint-specific testing. So for example, if you were having knee pain, this would be specific lower limb testing, so knee range of motion, hip range of motion, ankle range of motion, strength testing, plyometric testing. Again, it's collecting data. It's looking at where you're potentially weak, where you're potentially strong, and not just that, how you're moving side to side. Is there any apprehension when you're moving? Are you in pain, etc., etc.? Because as well as these physical qualities, so your range of movement, your strength, the ability to generate force, or plyometrics, how well you jump, it's also a brain injury as much as anything. So how are you inhibiting certain movements? Especially if you've been dealing with an injury for a long period of time, your body will play tricks on you and it will prevent specific tissues or joints doing things because it wants to protect them because you've been in pain for that period of time. So it's quite smart in that regard. So from that, you've then, let's just draw a little thing here. So you got some data. From this point then, we can then, I'll just make that a bit more permanent. There we go. So from there, you got some data, and then it's about, I'll just make myself a little bit smaller. There you go. It's about finding the weakest link. So out of all these things, what's the weakest link? What is the thing that we need to work on the most? And then from a rehab point of view, what do we need to prioritize in rehab sessions, depending on how many you can do a week? Then we go through a period of whatever time frame before we reassess. Usually this could be 3-4 weeks. It could be longer. It could be less time. It really depends. Then we retest and reassess. So have we improved the things that we prioritized? Are we improving? Are we not? Why is that? An example could be potentially we haven't prioritized the right things, or potentially the client or yourself hasn't been consistent with the exercises. That's another reason. And why hasn't there been consistency there? So it's always a why question there. And then retest, reassess, find the next weakest link. If we've done successfully this one, prioritization, and this cycle just repeats. So again, rehab should not be a guessing game, as you should understand from this diagram, even though it's very simplistic here. I've broken it down to be quite simple. It shouldn't be a guessing game. It should be a case of collecting data, whether that's objective, so actual strength numbers, or just how someone is moving, so coach's eye, and actually just looking if they're moving better. I think the combination of those two things is really, really important. So hopefully that was useful. Hopefully that makes sense, and hopefully you can take that forward with your injury/pain. Usually it's not one particular thing. Again, that's another thing you can take from this. It's very, very complex. Injuries are complex. It's a mixture of physical and mental contributing factors. So another key thing, when you think about how long this injury is going to take to fix, more than likely it's always longer than you expect. Potentially with the experiences you've had previously with coaches, physiotherapists, where typically, not always, but typically a hands-on approach where you're getting a massage, you're getting taped, and they say you have to keep coming back to these sessions and you're not really seeing improvements. That's a completely different mindset to going and seeing someone. They collect a load of data, they understand what your ideal outcome is, and then there's actually a structured plan in place with milestones to hit. And then you're constantly retesting and reassessing, so you're always on track. And if you're not on track, you can actually then look at what's going on from a data point of view. Why aren't we hitting this? Why aren't we pain-free here? Why haven't we improved these strength numbers? And then you can actually look at the data. Whereas with a hands-on approach, it can have benefits in terms of short-term pain relief, but you can't track anything. You can't track anything with a massage. That's why I really like an exercise-based approach. You can track how long someone can hold hamstring bridge for. You can track how much they can squat. You can track how good their hip mobility is, how well they're moving, how well they're walking. So hopefully that was useful. Any questions, just drop them in the comments down below. And if you're interested in what we do at FCR, just visit the link in the description.